My name is Ellen Hopper. I'm an obstetrician gynecologist here in Brookings. I work at the Avera Brookings Medical Clinic, and I've delivered hundreds of babies here at the Brookings Health System and hundreds of babies in my training elsewhere. Depending on when they had their first prenatal visit, the estimated due date is fairly accurate. If you have early prenatal care, generally most people now have an early ultrasound that helps to really determine when the patient's due date is. But it is just an estimation, and most women will deliver by 38 weeks to 41 weeks, which means 2 weeks before their due date or a week after their due date. So a woman should call her physician between regular prenatal visits if she is not feeling the baby move. And generally we like you to feel movements 10 times within 2 hours. I usually tell people, if you're not feeling baby move, get a glass of juice, go into a room where it's quiet so you can really concentrate and focus on baby's movements. If you're having severe cramping or contractions, any vaginal bleeding, the woman should call her physician. If you have a fever, severe nausea, vomiting, diarrhea leading up to dehydration would be a reason to call your physician. There are many indications or reasons that we would induce a patient's labor. Generally speaking, we will induce people if they're a week over their due date, so 41 weeks gestation. And that's because outcomes generally are better if we induce by about 41 weeks. There are lots of different ways that we can induce labor. There are pills and medicines that we give both orally and vaginally to help soften the cervix. There's a medicine that most people have heard of called Pitocin, which helps to increase the strength of uterine contractions. And then part of the induction process is breaking a patient's water. There are a variety of ways that pain management occurs during labor. Some people prefer no artificial pain management and use the Whirlpool tub, birthing balls. We have the volunteer doula program here at the Brookings Health System that can help with pain management. There are other people who do like medications to help with their pain during labor, and those can be given either through intravenous access through the IV or in the form of epidural anesthesia. Most people have heard of epidurals, and we do offer those here at the Brookings Health System. We have certified obstetrician gynecologists, just like the bigger facilities, who have had the same training. And many people worry that we don't have the neonatal intensive care unit here in Brookings. We do deliver babies 35 weeks and up, and we do deal with high-risk pregnancies. But certainly if we feel that your baby needs more intensive care, we will either transport you to Sioux Falls if that's needed, or transport you and the baby if the baby is indeed born here in Brookings. I know that Brookings Health System provides great care because I had my baby here.